quad set is the most basic exercise for your quad muscle in the front of your thigh. It's not going to strengthen the muscle. It's just going to help you activate that muscle and turn it on. After surgery, you'll have a hard time contracting the quad muscle, and a quad set is the most basic way to get that pathway firing again. So to do quad set, you can put your leg out in front of you, let it get as straight as you can, and then you're just going to try to contract the quad muscle right here in the front of your thigh. You should see your kneecap slide up a little bit towards your body. So you're just going to tighten up like that. You should feel the back of your knee push down towards the table, the bed, the ground, wherever you are. Like that. And just squeeze it, hold it 2 to 3 seconds, and then relax. Keep doing that. If you're having a hard time doing it, you can take a towel. You don't want anything too thick, something pretty thin. Put it underneath you, just to give you a cue to push your knee down into that towel. Okay? The towel is especially helpful if you can't get your knee fully straight yet and it's very uncomfortable for you. But as you progress, you should be able to take the towel away and just squeeze like that. You can also do them just sitting down, just put your leg in front of you and squeeze. And you can see how my kneecap moves up towards my body when I do that. There's no limit on how many of these you do throughout the day because it's just an activation exercise. So do them all throughout the day. If you're just sitting on the couch watching TV, you're laying in bed, just keep squeezing that quad. Okay? You should only have to do these in the first few days after surgery, maybe the first week or so, and then you'll move on to more appropriate exercises.